Back here in Canada, even finding a family doctor is impossible for thousands of people. And now there's new data specifically about women's health. A study by the Heart and Stroke Foundation identifies alarming gaps in diagnosing, caring, and even basic understanding of risk factors and symptoms of heart attacks and strokes in women. New data shows more than 32,000 Canadian women died of heart disease and stroke in 2019. That is one woman every 16 minutes. Women who have a stroke are at a higher risk of dying than men, and if they survive, their outcomes are worse. Katherine Ward reports on why there's been so little progress in changing that.
I did present to Emerge a lot because I was having heart attack symptoms like daily.
A runner, a teacher, a mother to young children. For years, Bobby Jo Green could not figure out why she was feeling so sick, and neither could the 8 cardiologists she saw over 5 years.
It was just kind of a revolving door of specialists, ER physicians, GPs telling me it's not your heart, reassuring me it can't be your heart, right? You're too young, you're too fit, you're too healthy. Not being believed was just as bad and just as traumatic as having the illness.
Green kept pushing for a diagnosis and eventually learned her heart was not getting enough oxygen and the arteries and vessels were not functioning properly. Her story is not uncommon, according to a new report from the Heart and Stroke Foundation. The numbers indicate symptoms go unrecognized for 50% of women experiencing a heart attack. In part, this is because men and women present differently. As a result, women are less likely than men to receive the treatments or medications they need, and women are more likely than men to have died in the year following a heart attack. The bottom line, heart attacks and strokes are the leading cause for premature death for women in Canada. Some risk factors for women include pregnancy and menopause, smoking, high blood pressure, diabetes, obesity, and depression are also on the list. Doctors say more gender-based research is needed to fully understand the scope of the issue.
Women traditionally have not been involved in research as much. And because of that, we don't have as much data on their heart health. If we don't take care of the risk factors, that it could continue to rise. And not only will be the number one premature cause of death, but will be a real leading sort of worldwide issue in women.
Katherine Ward, Global News, Toronto.